Medicare doesn't make any sense, and when it comes to understanding the different networks within a Medicare Advantage plan, it gets really confusing. So our goal here is to make this simple as 1, 2, 3. So right now what we're going to do is we're going to look at PPO networks. We're going to look at the local PPO network, and we're also going to look at the regional PPO network as well, so you understand the difference between the two. PPO network plans are offered as either a local PPO or a regional PPO. The local PPO is the most offered Medicare Advantage plan that an individual will see that's available to them. PPO network plans have an established network of doctors and hospitals in that local area. Individuals will typically pay less if they use the providers in that plan's network. The individual will have a separate out-of-pocket limit for in-network and out-of-network services. PPO network plans make it easy for the individual to simply log on to the carrier site and search for a PPO provider at generally a higher cost to them out of network. These types of plans are great for someone that's actually traveling. PPO network plans will typically not require the individual to select a primary care physician or need to get a referral from a specialist. Again, that's a big benefit, is that typically you won't be required to get a primary care physician, select a primary care physician, or get a referral to actually go see a specialist. Most PPO network plans, though, will require a prior approval or prior authorization for certain services when they're actually needed. RPPO plans, which are called Regional Preferred Provider Organization plans, have the in-network that will be consistent of a region instead of a local area. See, these plans were originally designed for those that lived in rural areas to have access to a region and not limited to just one state like a local PPO. Medicare has set up 26 regions around the country that comprise of one or more states that the individual will have in-network access to. So again, it's a region of several different states where that individual can go to those doctors and specialists within that in-network with that region. R.P.P.O. network plans allow the individual to also go out of network to anyone that accepts the plan at generally a higher cost to them and will follow the same rules and guidelines of a local PPO. They will typically have a separate out-of-pocket limit for in-network and out-of-network services. R.P.P.O. network plans will typically not require an individual to select a primary care physician or have to get a referral to see a specialist, much like that of a local PPO. So really, the local PPO and the regional PPO are very similar. The only big difference between the two is that the local PPO has a local area. The regional PPO has actually a region, usually of several states, that will be in network for that individual. Most RPPO network plans will, though, require a prior approval, a prior authorization for certain services when they're needed, just like that of a PPO. I can let you know that the RPPO plans are not as prevalent in most areas like the local PPO plans. If you have any questions about this, because we know this is confusing and overwhelming, please give us a call here at Healthcare Solutions Direct so that we can look at all the plans in your area so we can see exactly which one would be best for your particular situation.